I'm WTOP Capitol Hill correspondent Mitchell Miller, and thanks for joining us. My guest today is Michael Hogue, the CEO of the American Pharmacists Association. Welcome, and thank you for joining us.
Thanks, Mitchell.
All right, well, before we dive into the issues before Congress and a lot of other things related to pharmacy and their potential impact, could you tell us a little bit about your organization and what it's about?
Yeah, the American Pharmacists Association is the association that represents the clinicians, the pharmacists that provide care to patients in any practice setting. It could be in a hospital, a community pharmacy, pharmacists that work in the pharmaceutical industry, or maybe in academia. But most of these pharmacists are providing direct patient care day in and day out. We also represent the student pharmacists enrolled in pharmacy schools across the country, the pharmacy technicians, and the pharmaceutical researchers who develop new drug therapies.
Right, and I think a lot of people don't really realize all the things that pharmacists do. You go in, you pick up your prescription, but there's so much more, and it seems like it's really evolved over the years.
Yeah, if I were to put it in the most simple terms, most of us have a remembrance of the time when pharmacists used to make medicines before we had a lot of commercially available medications, and pharmacists still do know how to make medicines, by the way. But today our job is really to make medicines work, and so the primary function that a pharmacist has today is to make sure that every patient is getting the right medicine at the right time, at the right dose, and regardless of where they're at in the healthcare system, they either do that independently in a community-based pharmacy, or they're working alongside a healthcare team in a health system or a hospital, and making sure that every time there's an encounter in the healthcare system that the medicines are doing what they're supposed to do.
And I understand that the community-based pharmacy that a lot of us know, it's facing a lot more challenges today.
There are a lot of challenges facing community-based pharmacies, and I think what Americans are realizing is that rapidly we're losing access to the only healthcare resource that many consumers have in their local communities. I mean, you think about a lot of rural communities, there really isn't another healthcare provider. It's that local pharmacy providing the only access to healthcare. That's also true in a lot of major cities, big cities, where many communities of color in Los Angeles, New York, Atlanta, Chicago, Houston, there's only a pharmacy in certain local communities. And so we are concerned about many of those pharmacies having some really strong headwinds and making it very difficult for them to be able to survive.
As we both know, the pandemic created a lot of headwinds in many different ways, particularly for the healthcare industry and for people who needed help. Can you talk to us a little bit about some of the challenges that developed related to pharmacy and pharmacists in connection with that?
Well, there's really one major thing that happened during the pandemic, of course, and that is when the rest of healthcare essentially had to shut down because we had to divert physician resources to hospitals to take care of acutely ill COVID patients. The only healthcare that remained open in local communities were pharmacies. And as most all Americans know, you got all your vaccines in the pharmacy during that time frame. If you needed a test for COVID or you needed to be tested for the flu and treated, that happened in a pharmacy. It was the pharmacists that did all of those things during the pandemic. Created a lot of workload for pharmacists and pharmacies, in addition to getting the medicines to the patients in the right dose and the right duration. So that was a pretty stressful environment for pharmacists. That, coupled with downward pressures that have been exerted by PBMs on the reimbursement for pharmacies, have left many pharmacies without having any profitability to be able to continue to operate. That's caused reductions in force and increased work on the pharmacies. So it's a real conundrum right now.
All right, and just so people know, the PBMs are kind of the middlemen in connection with medicine and the insurance industry.
Right. So if you really think about it, you've got manufacturers that make medicines. Those are big corporations typically that are manufacturing medicines. They typically sell those medicines to a drug wholesaler that distributes the medicines out to pharmacies. And then there's a health insurance company that typically works with your employer to provide health insurance and coverage for all of those items, but whether it be the health care you receive from your doctor in your hospital or the medicines that you receive from your pharmacy. there is a middleman that has inserted themselves into this process, contracted with the health plans to manage the pharmacy benefit. And in the process of doing that contracting, they also try to get rebates and contract with the manufacturers for preferred status on their formularies. So what's happening is this middleman is essentially signing contracts with pharmacies that result in the pharmacy typically losing money on about 6 out of 10 of every brand name drug that they dispense, and a substantial portion of the generic drugs that they dispense are dispensed at a loss. So the pharmacy actually loses money, and of course there's nowhere in our economic system where a healthcare provider or a provider of any service can lose money on the majority of their business and still remain in business. And so the PBMs have created a very tense financial situation.
And let me ask you, where can the average person find more information about this issue with PBMs?
Yeah, this whole reimbursement issues in pharmacy and how your prescription drugs are paid for is probably one of the most complicated, confusing aspects of our entire healthcare system. So APHA has put together a website. It's endpbmsnow.com. And this particular website talks about some of the harmful practices that PBMs are engaged in, some of the proposals before the U.S. Congress to try to address those issues and to be able to bring a solution in place related to PBMs and how they interact with pharmacies. So consumers can go to that site, they can take action at that site and determine what their next steps need to be related to ensuring they continue to have coverage for their pharmaceuticals in a way that allows them to also have access to a local pharmacy.
And that brings us to some of the big issues in connection with what's happening before Congress. The PrEP Act. It is facing a critical period right now in connection with whether or not it's going to be extended. And I wonder if you could just explain to our audience what that means in terms of liability and the fact that if it expires at the end of the year, as I understand it, there's a lot of ramifications.
Yeah, the whole healthcare industry is on edge about this because during the pandemic, there were certain authorities that were granted by the PrEP Act, and the federal government allowed for certain healthcare activities to take place that would have, perhaps not been compensated or paid for by the federal government in the meantime. Among those things is the testing and treatment for certain respiratory infectious diseases, not just COVID, but other things like influenza as well. And most of those authorities improved access by patients to their healthcare providers, including to pharmacists. Almost all of those authorities will expire December 31st unless Congress acts. And so one of the bills that the American Pharmacists Association is championing would actually provide some permanency, particularly for our most vulnerable patients, our senior citizens, our Medicare beneficiaries, would provide that coverage from this point forward, because patients have learned it's very convenient to be able to come to your local pharmacy and receive the care that you're looking for.
And of course, all forms of legislation face a lot of hurdles, but as I understand it, the path toward the PrEP Act being reapproved or extended is pretty straightforward, but yet there are these hurdles that you have to cross. I wonder if you could talk a little bit about that.
Yeah, the PrEP Act is really, the Congress has got to pass a bill during the lame duck session that would extend certain authorities and provide for certain coverages under health care. We all know that the American public has grown accustomed to and appreciates the convenience that has been allowed for under the PrEP Act. For example, Medicare beneficiaries have been able to go to local pharmacies and have the support of the pharmacy technicians and the pharmacists to provide their vaccinations for influenza, for pneumococcal pneumonia, and for COVID. And that's a wonderful community access point. But if the PrEP Act authorities are not extended, it's possible that pharmacy technicians, for example, won't be able to assist pharmacists in providing that, which is really a logistical nightmare. And not only that, the coverage for vaccines and for testing will be changed under the authorities. And so that's why we're trying to get these things put into place. But Congress has got a lot of work to do. Many people think the lame duck session of Congress, nothing really happens. But this is a year after this election where Congress must act, or the American public is probably going to be pretty upset with what's left behind in our healthcare system.
It's really interesting. There's a pharmacy that's literally only a few blocks from the U.S. Capitol that was utilized for all those services you just spoke about. And yet down the road, just a few blocks away, there's really a roadblock right now as to what's going to happen with this legislation. And one of the things I understand is that it needs to go through what we as journalists on Capitol Hill are very familiar with, regular order. It really needs to go through a committee and be marked up. And it needs to go through a traditional committee, the Ways and Means Committee, to get that markup so that it can move forward.
Yeah, the Ways and Means Committee needs to take up the Equitable Community Access to Pharmacist Services Bill, which is H.R. 1770. On the Senate side, the companion bill would be S. 2477. And this bill is critical to ensure that Medicare beneficiaries continue to have access to the pharmacist's care services for testing and treating for respiratory disorders and for immunizations. Medicare beneficiaries are oftentimes the ones who are left in the most vulnerable position in terms of access to care, unfortunately. It's our nation's elderly and communities of color that are typically living in very rural areas, oftentimes in these inner city areas where there is no other access to care. The pharmacists are well trained. They've proven themselves capable of providing this service. They've been doing it at the state level. What we need now is to ensure that Medicare provides coverage for these services so that patients can continue to walk into their pharmacies come January 1st and receive this service. If Congress doesn't act now, Medicare beneficiaries will be denied important care, and we will see consumers in rural communities who will perish, unfortunately, because they will not have access to the care services of their local pharmacist. This is a totally preventable thing. All we need is for Congress, and particularly the House Ways and Means Committee, to act, and they need to do it now.
And this legislation does have bipartisan support. I know that also in the Senate, Senator Thune has been supportive of it. What have been some of the roadblocks beyond even just the getting it through this markup? Where do you think some of the opposition lies?
Yeah, well, this is, first of all, again, we're very appreciative that both parties understand that this is important, and members of Congress in both the House and the Senate have been getting phone calls from consumers and pharmacists alike who recognize that this is really important. I have a lot of physician colleagues. I came into my current position after working at Loma Linda University Health in Southern California as a part of a large health system, and our physicians and pharmacists collaborated together all the time to make sure that patients had the best outcomes associated with their therapies. We appreciate that physician support, but organized medicine at the national level is trying to say that this bill is a scope of practice bill and that it expands a pharmacist's scope of practice. That's just simply untrue. States govern the scope of practice. That's a states' rights issue. The federal government doesn't issue scope of practice. So this bill doesn't do anything with the scope of practice of a pharmacist or any other healthcare professional. This bill simply provides payment for the service that a state authorizes a pharmacist to provide. So that's exactly what we're trying to do, is to make sure that we don't decrease the amount of access that a patient would have to care through their local pharmacy. Makes perfect sense, and I think when people don't conflate the two things of scope and payment and realize that this is just a payment bill, this is not a scope bill, then it makes perfect sense. We want to continue to let our seniors have access to the care that they've become accustomed to during the pandemic.
And do you, certainly you hope, but do you think you have been making some headway? And as we get to this, it really is critical, as you point out, that sometimes Congress needs a trigger mechanism to get something done, and often that is the calendar. In this case, that is something that seems to be on your side.
Well, it is, and I think the other thing that is very much on our side is that the CBO has scored this bill, and this bill comes in at about $2 billion over 10 years, which is a very affordable expenditure, and in fact, we believe the savings associated with this bill will far offset the costs associated with it. As you know, the CBO doesn't always score savings, and so we believe that this increased access is ultimately going to lead to tremendous savings in our healthcare system and for the Medicare program, this improved access. I mean, just think about it for a moment. My mom and dad live in a very rural community in southern Illinois. They have to drive 65 minutes to get to their physician because their family practice physician is over an hour away from their house. Wow. They're in their 80s. They have a pharmacy that's a 10-minute drive from their home. Their pharmacist, Dr. Allison Reichert, is a phenomenal pharmacist that really takes care of their healthcare needs. When mom and dad think they might have the flu or COVID, doesn't it make a lot more sense that they drive 10 minutes to their pharmacy? Allison can do a simple nasal swab test, figure out if they have COVID and flu, and then treat them for it if they need the treatment for it. Then she can, of course, refer them on to their physician if they need follow-up care. That makes perfect sense. It's affordable, it's reasonable, it's cost-effective, and doesn't that make a lot more sense than 80-year-olds having to drive over an hour to get to a local doctor's office or a hospital and potentially being admitted because they put off getting care as a result of the inconvenience of having to drive an hour? Just makes perfect sense when you put it into those terms and you really think about how does this impact every member of Congress's family. I mean, I can't imagine that there wouldn't be members of Congress who'd have the same situation that I have in my own family.
Well, I think on that personal note, that really shows what impact this really has, and that it's not just some amorphous piece of legislation out there. These decisions do have a real impact on real people. So thank you very much for joining us.
Thank you.
I'd like to thank today's guest, Michael Hogue, the CEO of the American Pharmacists Association. I'm WTOP Capitol Hill correspondent Mitchell Miller, and for more on this discussion, visit WTOP.com and search American Pharmacists Association.